Hello and welcome. I'm Sean LaFrance, the Executive Director for the Foundation for Healthy Communities. And in 2016, the Foundation is celebrating 20 years of service to advance the health and well-being of people in New Hampshire. For 2 decades, the Foundation has worked with partners, patients, and communities to improve the health and well-being of people in the Granite State through dozens of initiatives. We've invited some of our partners today to share brief observations of their experience with the Foundation for Healthy Communities. We appreciate their support and thank you for watching.
I've actually had several opportunities to partner with Foundation for Healthy Communities. First of all, I was fortunate enough to serve on the board, including as the chair. And it really was a unique experience where insurers, citizens, hospitals, and other healthcare entities came together for the good of the community and for the good of the patient. And it was really an exciting opportunity to be able to focus on quality care and the health of the community.
I would say we've had a lot of experience working with the Foundation. I've actually been at the Community Health Center for 20 years, which is about the exact length of time that the Foundation has apparently been alive. So I have worked with many of the staff on the different projects that I'm familiar with. So the MedBridge program we've had in place for almost 20 years now. We've been a member of the New Hampshire Health Access Network. We post all of the clinical guidelines in all of our exam rooms that are produced on an annual basis, and we also utilize the Advanced Care Directive formats that are produced. And we also now, of course, work collaboratively with New Hampshire Med Bank, and we have a relationship with the New Hampshire Health and Equity Partnership, and the person who coordinates that program is housed here, and I'm the chair of the data subcommittee, and she's my co-chair. So we have a lot of crossed or interlaced relationships.
After being in New Hampshire for almost 7 years and having the pleasure of working with the Hospital Association as well as the Foundation, I've really come to appreciate the unique relationship and the value of this model that we have of this collaborative partnership with the Foundation and the Hospital Association, because I think it helps benefit all of the healthcare organizations in the state. You know, while the Hospital Association has a lot of focus on the legislative and advocacy issues, it's well complemented by the initiatives that the Foundation provides, particularly around healthcare access, around population health, creating healthier communities. To see these different programs that the Foundation runs have an impact on the health of our communities is just a tremendous asset to the state.
The Foundation for Healthy Communities has really been a great organization to help build different models of care, focus more on community health. I think a couple of examples I can share are when the advanced care planning work was done in the early 2000s to really help the community with the conversation about end-of-life care. Another opportunity that has been was very supportive for the home health community was the WALK grant, where it was a workforce opportunity grant to help build clinical skills for the nurses who worked in home health. The Home Care Association of New Hampshire and the Foundation came together to offer clinical training for nurses throughout the state. And I think that another area, the last area that I would mention, is a whole prevention program, particularly the fall prevention that has just started over the last year or so. The Foundation was instrumental in getting funding for communities, some up north, some in the southern part of the state, to help improve fall prevention for seniors.
As Anthem Medical Director, it's been really a privilege to see what the Foundation for Healthy Communities has created. Back in its infancy, the organization created the Managed Care Medical Director Forum, and this was a place, an excellent white space to bring forward issues that were important not only to Anthem as a company, but also to the residents of the state of New Hampshire and to providers. We were able to build numerous workflows and processes that really coordinated across everyone. Some good examples of that, which people really forget about, was the universal application service that was started in New Hampshire and now is really a national issue. That was started through that organization, but also numerous other guidelines that were developed, like a back pain guideline, the radiation safety guideline for providers to use. They felt this was a functional use of a tool that would span all insurers, that also had an effective impact for residents of this state. The other activities have been the formulary that was able to be used by providers so they could see what medications were acceptable to an insurer. It became a very useful tool. And certainly the preventative healthcare guidelines that were uniform, that all the plans would agree on. This is long before even ACA has taken place. There was a universal acceptance in New Hampshire of these activities, and certainly this made it easier for providers to practice.
Our experience has been great. We were able to help a lot of people from the community. The staff who were part of the Train the Trainer program were able to take their training and then also bring it to people in the community. I think the experience was very collaborative from the beginning. When Sean first called and was telling us about the program, we had just opened a new rehab gym area, and we felt that this was a great opportunity for us to be able to start offering services to the community. And certainly my staff, Amber and Aaron, were both able to increase their skills, and it's given them a lot of job satisfaction. And they also have learned the evidence-based practice piece of it was huge, because we felt that these, they learned more about how our residents can, and the community, elders in the community, can really age in place well.
I have really enjoyed my partnership with the Foundation for Healthy Communities. I think that the foundation has really been a leader in healthcare systems, looking at more than clinical care, helping hospitals and healthcare systems as they've moved to look at quality and population health. And it's been exciting to be part of that. We were among the first round of grantees for the Healthy Eating Active Living Initiative, the HEAL program, and have found that technical assistance, the mentorship, the program ideas, the support as we have gone through the last really 8 years, I guess, to be very, very helpful.
An important role that the Foundation for Healthy Communities played was convening the Health Engagement Network for hospitals in the state of New Hampshire. It was a fantastic opportunity to come together and learn from each other and share best practices for a dozen different conditions and safety opportunities and initiatives. And there's no question in my mind that the partnership that was supported by Foundation for Healthy Communities has made our hospital, as well as those of my peers, safer for the people that we serve.
My full-time job, I'm a center administrator, and so my challenge there is to be a core resource that makes the whole greater than the sum of the parts. And that's exactly what the foundation does for the collaboration. It is the infrastructure. It allows us to focus on our particular interests and what motivates us and the energy we want to devote to the work, knowing that the foundation is the backbone.
I've enjoyed working with the foundation. It helps to partner with other facilities and hospitals, and again, it just improves patient care.
So my organization is the Manchester Health Department, and I work specifically on something called the Manchester Community School Project. And when I began this work, I was hired to outreach specifically to vulnerable populations. And I'll be honest that I myself wasn't quite sure what that looked like or what that would mean. And so it really has been with the guidance of the foundation and the additional skills and technical expertise that the Health and Equity Partnership that has provided me and provided my organization that has encouraged us to take an equity lens to everything that we do. I have been, again, very privileged to be part of this work, and am incredibly thankful to the foundation for supporting it in the way that they have been.
The statewide contacts, the visionary kind of leadership that Sean and others at the foundation have really enabled the cancer collaboration to be what it is today. I honestly can't imagine us having an annual conference with nearly 200 people, and with the third iteration of our cancer plan happening without the leadership and the support and the visionary leadership that has come from the foundation.